How do I prescribe controlled substances across state lines via telehealth? Imagine a patient in one state needs medication for a mental health condition, but you're licensed in another state. How can you safely and legally prescribe controlled substances across state lines? That's what we're going to explore today. First, federal laws play a big role here. The main law is the Ryan-Haight Online Pharmacy Consumer Protection Act. It used to requiring an in-person exam before prescribing controlled substances. But recent changes have shifted that. Starting in early 2025, the Drug Enforcement Administration and the Department of Health and Human Services have allowed certain practitioners to prescribe controlled substances based on telehealth visits alone. This includes audio-only consultations, as long as the provider reviews the patient's prescription drug, monitoring program data from the patient's state and documents this review. These new rules took effect on February 18, 2025, and the DEA has extended temporary waivers through December 31, 2025. This means providers can prescribe Schedule II through Schedule V controlled substances without a prior physical exam, as long as they follow the rules. There's also a proposed special registration pathway for certain providers like psychiatrists, hospice doctors, and pediatricians to prescribe controlled substances via telehealth without an in-person visit. But federal rules are just part of the picture. State laws vary widely. Some states requiring an established patient-provider relationship, which might include an in-person exam or might be satisfied with a telehealth visit. Others prohibit prescribing Schedule II substances through telehealth altogether. It's essential to check that you are licensed or have a telemedicine registration in the patient's state. You must also verify that the patient is physically in that state during the consultation. Another key step is reviewing the patient's prescription drug monitoring program data. These are state-run databases that track controlled substance prescriptions. You need to check this data before prescribing and keep a record of the review. This helps prevent misuse and ensures safe prescribing. When you're ready to prescribe, make sure your telehealth platform complies with privacy and security standards. Document the telehealth visit thoroughly, including the evaluation, the review of prescription drug monitoring program data, and your prescribing decision. Remember, prescribing controlled substances like stimulants or benzodiazepines may have additional restrictions, so stay updated on both federal and state rules. Remote patient monitoring and ongoing teletherapy can support your prescribing decisions by providing continuous assessment. And always coordinate with pharmacies to ensure the prescription can be filled properly across state lines. In summary, prescribing controlled substances across state lines via telehealth is possible but requires careful adherence to federal and state laws. Recent regulatory changes have increased flexibility, especially for certain medications and providers. Always verify licensure, conduct complete evaluations, review prescription drug monitoring program data, and document everything carefully. Staying informed about evolving rules helps you provide safe, legal, and effective care for your patients no matter where they are.